A problem that a lot of men have. It's so common, we see it in guys as young as 40, 35 sometimes, because it depends a lot on their habits, on a lot of the way the exercise habits, their food habits, they're very obese, they have diseases like hypertension, dyslipidemia, which is high cholesterol. All these things contribute to erectile dysfunction. But it affects men because they cannot get erections. And that has to do with the circulation, the arteries that go to the penis and to the prostate and testicles in that area, the perineum. Sometimes these arteries start getting blocked up, like arteriosclerosis, just like the arteries that go to the heart, they'll get plugged up as well. So when that happens, you don't have enough circulation, and then the penis doesn't fill and hold the fluid that it's supposed to have, the pressure. And so then a person does not have adequate erection. So erectile dysfunction is very important. We have a lot of patients that are diabetic, right? Because this is very common in diabetics. It's also very common in people that have high blood pressure and cholesterol and are taking medicine for a long time. So a lot of it's disease related. Some of it is just lifestyle related.
We got patients from all the age, like from 28 years old to 84 years old. The result is very good results.
The better results are with
The
younger person, of course. 80-year-old people, sometimes they get some results, but of course not as like if you were 40 or 35. So we get people that come calling from different ages, right? Pretty much all decades. So a lot of people, it just happen with time. Most people that you talk to, most adults tell you that they don't have the strength that they used to have, which is very common. And that's understandable. As men get older, that just starts happening. Prostate grows. Our hormones start dropping, like testosterone and DHA, dihydroepiandrosterone, growth hormone, and other things that drop, all the other hormones that drop, and then we develop these changes. Arteriosclerosis is accelerated when our hormones are down, just with diabetes and other diseases. So it has to do with vascular and nervous problem. When diabetics, they have neuropathy, the nerves don't work very well, and so that's another reason why they have erectile dysfunction. Okay, Gainswave is a machine that we have. It is a German-made machine. It's like therapy, like ultrasound. It's a very powerful type, limited but powerful ultrasound. They're totally different. You can use them both together, and we often do. Gainswave is a physical therapy procedure. That's what it is. So it's a physical means to improve your condition. Viagra works completely different. It works through the system, through prostaglandins, through other methods that we have in our body. Block an enzyme that helps you retain more nitric oxide in the arteries and of the penis, and that helps the erections. Viagra is a medical treatment. It's a medicine, a pill that can be taken by mouth, and it helps improve your sex drive and also your function. And the Gainswave, that one helps improve the underlying condition in the circulatory system. The advantage is that it is a non-invasive physical therapy type equipment that helps try to correct the problem. But I have nothing against Viagra. I think everybody, all those people that have ED can also use Viagra or Cialis or any of these other products, as long as they're not on nitroglycerin type medication for the heart.
It works in the vascular system on the penis, okay, and it's the main point that we are working.
It's an acoustic wave. It's a shock wave kind of ultrasound. Similar technology that we use to dissolve kidney stones. You've probably heard of that on television. People have kidney stones, instead of opening up with a knife and taking it out surgery-wise, we use lithotripsy, which is a system that is used to dissolve the kidney stone just with sound, ultrasound. Very powerful sound, breaks up the stone, and then the body just makes it in smaller pieces, then the urine takes it out. This is a similar type of technology, but it's a smaller machine, of course. It's handheld probe, and when you put it on, it shocks it. It has a kick to it, because the sound wave is like, I guess like when you break the sound barrier a little bit, it just pops, and that breaks down the plaque. It's formed to a certain degree with calcium. It's calcium deposits and other minerals, and so it breaks down the plaque, and then the artery opens up. So at least that's the theory, and that's what we have found in it. In other parts of the world, they're beginning to use it, or they're doing experiments using this machine for trying to break up the cardiac, the heart arteries. But in our case, we use it for erectile dysfunction, or normally called ED. So you evaluate the patient and basically you find out how bad they are or how good they are or what condition the erectile dysfunction is. And then we want to do just a brief exam. We don't do a total exam because, you know, all of you will have your own physician, unless there are patients on the medical side, then we do the whole exam. But what we want to know is how your vascular status is and how your sugar is, those kind of things, because those affect. And then hopefully if you're on medication, you keep on taking your hypertension medicines. All that does not change. So this is a non-invasive procedure that uses no drugs. We do evaluate the hormones to see how the testosterone is and how the male hormones are. Because if they are low, we want to give you hormones to elevate the levels, and that makes you feel good as well. It gives you a better libido, which is your sex drive, improves your sex drive. And testosterone does a lot of other things for the body, so if it is low, we want to correct that as well. Basically, that's it, right? Then you put them in every week. You do a treatment every week.
Every week
And
for,
then-
for 3 weeks. And the treatment consists in 6 treatments, and that's it.
If you have any questions, call us. Call for the appointment on the phone that is here on the screen, and we'll give you a free evaluation. Just come in, we can talk to you, see if you something that you want to start. No obligation, no pressure. See if you like to start on it. We have good results. Not everybody does well. It's not 100%, but it helps a lot in many people.